Myocardial infarction, heart attack. A myocardial infarction, also known as a heart attack, is a serious condition where the supply of blood to the heart is suddenly blocked by a thrombotic occlusion of the coronary vessel, caused by rupture of a vulnerable plaque that blocks the coronary artery, where your heart muscle begins to die because it isn't getting enough blood flow. Signs and symptoms of a myocardial infarction include central chest pain, which is described as a vice-like crushing pain that can worsen over time. This commonly can radiate to left side, but can also radiate to the right side of arm, neck, jaw, and abdomen. Shortness of breath, nausea, vomiting, pale, clammy, and sense of impending doom. The use of an out-of-hospital 12-lead electrocardiograph, ECG, has long been the salient test used when assessing ischemic chest pain and is the only clinical tool available to paramedics that allows for early diagnosis and triage of acute coronary syndromes. Although an ECG is not a definitive test in diagnosing AMI, it can help determine what type of heart attack, which can determine the most effective treatment. Damage to your heart from a heart attack causes certain proteins to slowly leak into your blood. The most common protein measurement is called cardiac troponin. Your troponin level can help in diagnosing the type of heart attack. The troponin levels become elevated early in the disease process, where the amount released is determined by the MI size. Subscribe to the channel for more.